Hello friends, today we are starting with our first topic, that is cardiovascular system, and very first part of it is hemodynamics. I am Professor Navle, your pharmacology teacher, and we are beginning with our first lecture. Learning outcomes. On completion of this topic, specifically this video, you will be able to know what do you mean by hemodynamics, how the normal functioning of the CVS will be there, how the heart works as a pump, working of the blood vessels, blood as a connective tissue, and normal and abnormal values of the CVS. I want to highlight over here is that this topic hemodynamics we will be covering in two parts, part 1 and part 2. Basically we are dealing with the cardiovascular system. So what is a normal cardiovascular system means? Before going to the pharmacology of a cardiovascular system, we should know what is the normal of the normal values of the cardiovascular system, how cardiovascular system work normally. So if you see go towards the hemodynamics, often it is referred as a basic measure of a cardiovascular system. Already we have seen that basic measure what cardiovascular system is, that about we are talking. Okay, it consists of arterial pressure and cardiac output, whatever the pressure which is created in the arteries and the heart as a pump whenever it is. So in a present preview, it is referred as a physical study of a flow of a blood to the solid structure which is called as arteries. Whenever the blood is flowing through a arteries, a blood vessels, then how it is done. Okay. So this cardiovascular system or hemodynamic system principally consists of a three parts: heart, blood vessels, and a fluid which is flowing through that system which is called as a blood. So these three components of the cardiovascular system, heart, blood, and blood vessel, combined together it forms a cardiovascular system. What is a cardiovascular system? What are the normal things about? We have studied all the things in APHE already. Cardiovascular system, complete cardiovascular system. But we have studied over there the anatomy and physiology. Here in that context, something which is referred to the normal values क्या है or how they are going to affect the pathophysiology in our second year B Pharm, and then how it is affecting your pharmacology in a third year B Pharm. Therefore we have to study the cardiovascular system as a hemodynamic normal what it is present overview, it is like that way. So again, the hemodynamics is a basic measure of the cardiovascular function. Previously, in previous slide only, we have already seen. So if you see a structure of a cardiovascular system, it is just like similar to that of a water supply system and the uh, drainage system of your city. So water is always circulated over there. Uh, there is a large tank inside your city which supplies the blood, sorry, not the blood, water to all the city. There is a big pipe which is coming from the tank, then which is going towards the various directions of the city. One is going toward the south, one is going towards the north, one is going to the east, one is going to the west. And that big pipe is converted into different areas. Then the different area pipes will come to your gully, then towards your apartment, then into your flat or into your house. Then whenever it is coming into your house, it will be again distributed, one towards the bathroom, one towards the kitchen, one which is going towards the bathroom will be again divided into two, one to the shower and one again to the basin and all these things. So one big pipe is coming and it is distributed throughout the day, throughout the city. Now similarly in our body, the cardiovascular system is arranged. One central part, the pumping station, which we'll call as a heart over there, which is distributing the blood to the aorta, which is coming, one is going towards the upper part, second part is going towards lower part, then that big blood vessels is going towards the different organs, then they are divided into arterioles, then it is divided into capillaries, and at the capillary end that blood will be delivered to the tissue. It will be for the exchange, similar as that of you're opening the tap and you are getting the water out of it and utilizing it. Now what happens once you utilize that water? It will be again collected. One collection pipe comes from your basin, one collection pipe comes from your kitchen, one collection pipe comes from your bathroom. Then these three combined together, that is the pipe of your own house. Then there will be a pipe from your own apartment, then your gully, then your mohalla, then your area, and there will be a big drain line for the complete city which is going out. Similarly, the capillaries, they are united together to form the venules, small venules, then big venules, then vein, which is ultimately merged into the superior vena cava and inferior vena cava, then which is coming again towards the heart, similar to that of your water supply system which is inside. The only thing which is here, the difference is that there is one purification system and one distribution system in our heart, in our body. uh, One distribution system which we will call as a systemic circulation, and one purification system which is we call as a pulmonary circulation. The blood which is coming from the superior and inferior vena cava are fed to the lungs, and after purification, after oxygenation, the blood which is coming from the lung will be fed to the systemic circulation. So this is what the actually the normal structuring of the cardiovascular system is, and it composed of one central part, that is a pump which is called as a heart, which is having a two part. One is for the pulmonary circulation, a small part, and another large part is for the systemic circulation. So it will have a distribution network. Ultimately, we have already seen along with that, that is our big arteries, aorta first of all, then arteries, then arterioles, then capillary network. Then they combine together to form the venules, vein, and superior vena cava in inferior vena cava. Then this distribution and collection network over there, and through that distribution and collection network, the blood is flowing, a fluid is flowing, which is called as a blood, which is a one type of a connective tissue. Okay. Now, I want to give you here some spot that you pause this video over here, take out your notebook, and write down the various parameters which are related to the heart, hemodynamic, which we also call as a hemodynamic parameters of the heart. So pause the video, and when you finish it, just play the video and see what are the answers. So the various parameters which are related to heart, that can be like over here, heart as a one pump. First of all, it is working as a pump, and it is a dual pump. We have already seen that one part is working for the pulmonary system and another part is working for the systemic circulation. So the very first part or very first parameter which is related to the heart is a cardiac output. Cardiac output means how much amount of the blood is given by heart in a 1 minute. Heart rate means a strokes per minute. And what is the stroke volume? Stroke volume is the amount of a blood which is given by a heart in a one contraction. Whenever it is contracting at once, it is giving the blood. And heart rate means these contractions per minute. So cardiac output is total amount of a blood which is given out by the heart in 1 minute, and stroke volume is the amount of a blood which is given out per pump or pump cardiac bit one. So within 1 bit, whenever the amount is thrown out, it is called as a cardiac volume, whereas a total amount which is sent within a 1 minute is called as a cardiac output. Cardiac index. So cardiac index is little bit it is a ratio whenever it is taken as a cardiac output in relation to the surface body. Many times the surface of the body is very large and cardiac output is very less, so cardiac index will drop down whenever the it is inappropriate. So it is a relation between the cardiac output and your body surface area. Now the next term which is related to the heart is a preload and afterload. These are the two associated terms basically. Preload is loading of the heart, we can say. So just like putting a material inside your vehicle or like that way, there is preload, means loading the heart. So it is a diastolic pressure. Diastole means, we are knowing diastole means relaxation of the heart. So the heart is relaxing due to the filling of the blood from the auricles into the ventricle. So some pressure will be there, and by that pressure your ventricles are filled. So how much amount of pressure is there on a heart whenever these ventricles are filled? So diastolic pressure that distends the ventricle, so it will distend, it will go for the relaxation, and there will be a filling of the heart. So this is what is a preload. Pre means loading of the heart. So filling of the ventricles, that is called as a pressure by which the ventricles will be filled, that is called as a preload. Afterload means systolic ejection fraction. What happened that after that the heart will contract and it will eject the blood. So it is a systolic ejection fraction. Kitna hai? Afterload. So once it is filled, it will contract, and due to the contraction the blood will be ejected out, and this is called the force. At that time how much amount of the force will be there, and that force is called as afterload. Then these three terms I think we have already studied in our previous lectures or previous year's lecture, that is chronotropic, inotropic and dromotropic. This has also a reference towards your ANS. Whenever we have studied that effect of ANS on heart and all like this. Chronotropic means which is related to the heart rate. Rate means whenever the heart rate is there, whenever 72 beats per minute, 80 beats per minute, 90 beats per minute, or heart rate is there. So if it is related to the rate of the heart, contraction of heart, then it is always a chronotropic. So the term specifically used whenever there is an increased heart rate, it is called as a positive chronotropic. When there is a decrease in heart rate, it is termed as a negative chronotropic. Then second term is inotropy. Inotropy, which is related to the heart contraction, or also called as a force of contraction, at how much force it is. So it is something which is related to the preload and afterload. And first chronotropy is related to cardiac output, like that with it. So inotropic is force. By how much force, how much is the heart contractility? Force is there. So if it is contracting by the great force, then positive inotropy. If it is contracting but not as that much force, then it is called as a negative inotropy. Inotropy means force of contraction. And last one is a dromotropy. So dromotropy is nothing but the velocity, at how much speed there is a transfer of a impulse, or there is a transfer of a signal. Like we are knowing in cardiac cycle, there is a signal transfer from SC node to AV node to Bandala fees and Purkinje fibers, like that. So at how much speedily they are velocity, what is the velocity of that? So at what velocity the conduction is done, this is what the dromotopy means. So these are the parameters which are related to the heart, the normal parameters, the pumping, then giving out, a stroke, cardiac index, preload, afterload, chronotropy. There are lot many along with that, like ECG, that echocardiograms and all these things. But here, as far as the pharmacology is concerned, we have to deal this much only. So we will take a small pause over here. Here the part 1 of our hemodynamic system is finished, and immediately we will go for the part 2. Thank you very much.